Agreed to, and I call the honourable member for Canberra.
Thank you, Deputy Speaker. I rise this evening to speak on the Medical and Midwife Indemnity Legislation Bill 2021. This bill will amend the Medical Indemnity Act and the Midwife Professional Indemnity Commonwealth Contribution Scheme Act. It will expand the coverage of professional indemnity insurance schemes to a group of midwives who, due to gaps in the current legislation, have been excluded unfairly due to their employment status. In Australia, midwives are registered under the Australian Health Practitioner Regulation Agency by the Nursing and Midwifery Board of Australia. Midwives are characterised as either registered or endorsed. Registered midwives are registered to provide midwifery care only, while endorsed midwives are registered to provide midwifery care and prescribed medicines. Currently, if you are a midwife in Australia, you have two options when accessing professional indemnity insurance schemes. These are allied health schemes available to registered and endorsed midwives, and the professional midwife scheme, which only covers endorsed midwives. However, both schemes exclude midwives in circumstances. If you are a registered midwife that holds insurance through your employment contract, you are ineligible for the allied health scheme. In the professional midwife scheme, if your employer is not also a midwife and the other stakeholders and directors of the company you work for aren't midwives, you are excluded. This has particularly impacted midwives working in Aboriginal community-controlled health services and has meant that the range and quality of midwifery services being accessed in remote Indigenous communities has been restricted. The changes made in this bill will be an important step forward in improving maternity care offered to First Nations communities and closing the gap between outcomes for Indigenous and non-Indigenous mothers and babies. We must continue to do more to ensure that First Nations mothers are fully supported with culturally sensitive support and care throughout their pregnancies. Deputy Speaker, it is important that all midwives, irrespective of their personal employment contracts, should have access to indemnity schemes. This bill will ensure that they do. These amendments bring into line our legislation with the established Commonwealth policy to ensure that claims made against all registered midwives have coverage and that there is a parity in the arrangements for all registered allied health professionals. This bill explicitly ensures that all midwives who have previously been excluded will be able to access the scheme regardless of their individual employment status. Key stakeholders have been advocating for this change for a significant period of time. The College of Midwives in particular have been key to ensuring that this change has been introduced, and I want to thank them and their members for their hard work in seeing this through. I'd also like to acknowledge the Australian Nursing and Midwifery Foundation, who have supported the implementation of the expanded access for midwives. However, there is still work to be done. Unfortunately, this bill fails to cover home births, largely a result of the resistance from insurance companies. I note and welcome the commitment of the Minister to continue to work towards home birth coverage going forward, and encourage Australia's medical insurance industry to engage constructively with the government and other stakeholders to ensure that this is achieved. And when it comes to midwifery and birth in Australia, home births aren't the only issue that requires more attention from this Parliament and legislatures across Australia. I want to talk about continuity of care and the care that we give more generally to mothers here in Australia. I must say that these issues became more apparent to me because of two things. One was, of course, becoming a mother myself, but also through being pre-selected and then elected, it became apparent to me that this issue is so important to so many people in the community who asked me, would I advocate on these issues and talk to me about these issues. And the key issues are around choice for mothers. Mothers want some choice, and home births is an issue there, as before mentioned, that midwives don't have the coverage to enable more women to have that choice if that's what they want. When you're a first-time mother, you are very vulnerable to what you are told and the access to care that you have. And also, as mentioned before, particularly women in First Nations communities, remote Australia, etc., are more at the hands of whatever is available for them to have that care through their pregnancy and birth. I met with a wonderful group in my electorate called, they're now called Maternal Health Matters, but they were previously called Safe Motherhood, and their goal is that all mothers have respectful care and safe motherhood for all. And I'd never thought about that concept of safe motherhood before, that we are when we have our babies, we are quite vulnerable, and there is much that can be done to improve the care for women, and midwives are such an important part of that. I want to really acknowledge, the work that midwives do every day. They come into a moment that is, incredibly transitional in your life, in the life of a family, not just the mother, but partners as well, and of course the baby. And they deal with what can be an incredibly stressful and challenging situation, and usually a wonderful situation. And I want to thank them, and I particularly want to acknowledge the midwives at the Canberra Hospital who helped me to give birth to my 2 beautiful babies. So when meeting with Maternal Health Matters early on, we were talking about, the care that mothers receive, and particularly the call for continuity of care, which evidence supports as the most important thing for mothers to be able to access in terms of their outcomes and that of their baby. This is something that the evidence points to as being incredibly important for the health of mother and baby following birth, and how the birth itself might go. Here in Australia, we do very well in terms of mother and infant mortality, with the exception, of course, of First Nations communities. But we don't do so well on the comorbidities around motherhood. We have high rates of postnatal depression. Around 1/3 of women describe their birth as traumatic. And there is a lot more we can do for that. And continuity of care with a known midwife throughout your pregnancy and your birth can help a lot with that. And I can say, as a relatively recent first-time mother, that to have the same person that you were seeing throughout that pregnancy means so much. For me, that was my GP, because I couldn't actually access the continuous midwife care here in the ACT simply because it's so popular. So many people want to access that. So in discussing these issues with Maternal Health Matters, they said it's really a question, we judge a society by how we treat our most vulnerable. And I had a penny drop for me that we don't see new mothers as vulnerable in this country. We see babies as vulnerable, but not so much mothers. And they absolutely are. This is a huge transition in their life that can really go either way. And it's that support from their community, from doctors, but from midwives that we could see through this continuity of care model. Many constituents have also written to me about this issue, and also about a new documentary that's come out called Birth Time, in which Australian mothers have shared their journey. And I've not yet been able to see this, but I'm going to a screening of that with Maternal Health Matters in July, which I hope many in our community will be able to come along to as well. It highlights some of the shocking realities that women face, and it shines a light on the unspoken epidemic of postnatal depression, and also that suicide is the leading cause of maternal death in the developed world. So there is more that we can do, that the federal government can do about this issue, where we have only 8% of Australian women having access to this model of care. So I really hope that this is something as a parliament we can consider further and work further on. And just again to acknowledge all the people in my community who've written to me about this issue, the great work that Maternal Health Matters does, and the midwives who support new mothers and their babies every day. Thank you.